We're going to talk to two nurses who were in long-term care during the worst of the pandemic.
This is Nurses Voices. Nurses Voices is supported by the Canadian Nurses Foundation and by the Canadian Nurses Association.
Welcome to Nurses Voices. I'm Gail Donner.
And I'm Mary Wheeler.
We'll be talking to two nurses from Montreal. Both women were at the bedside during the critical surge of COVID cases in long-term care. Their experience during that very sad time and their own careers and passions will give all of us a lot to think about. Roya Kazempour is a nurse from Iran who's been working as an RN in Canada since 2014 in the elder care unit at the Montreal Jewish General Hospital. She also worked in the long-term care unit at that hospital during the 3 COVID waves. Natalie Stake-Doucet is an RN currently working in a vaccination clinic. She's been a nurse and activist for 10 years now and president of the Quebec Nurses Association. Natalie worked also in long-term care during the first wave of COVID in Montreal. Natalie is also a PhD candidate at McGill University in Montreal. So welcome, Natalie and Roya. Both of you were in long-term care during probably the absolute worst of the pandemic. And Natalie, I'd like to start with you if I could, and ask you if maybe you can just introduce us to what that experience was like for you.
It's still something I'm struggling to put into words. I ended up in one of the worst long-term cares places at its worst time. So I was in a long-term care home called Yvon Brunet in April. And we lost, the official number is 73 residents died in about 2.5 months. It was, it's really hard to put into words. I mean, it's something I never thought I would see in my life, in my career as a nurse in Canada, in Montreal. It put everything in question and made me extremely angry. I'm still angry today at what we had to go through, all the staff, the residents, the families. And I'm really, in some ways, I think holding on to that anger so I don't fall into despair, because it was a very, very difficult time. And it was not something we should have gone through given the resources that do exist in 2020 in Canada, in Quebec. I think a lot of people died really terrible deaths when they shouldn't have. That's been driving me since then. Basically, it's been over a year now, but it's not something you can just move on from. And, you know, we don't know, is there going to be more pandemics? Probably in our lifetime. I mean, it's reasonable to think that. Epidemiologists speak a lot about, have been warning about pandemics for decades now. And we know residents of long-term care homes are much more vulnerable, not just because of their health, but now we know because the healthcare system makes them vulnerable, because the care homes themselves are in old, dilapidated building with terrible ventilation, with 1 bathroom for 2 rooms. So there's a number of structural issues that make their vulnerability so much worse than it actually should be. So I'm trying to focus on that and trying to act as much as I can with colleagues on changing that, at least.
Yeah, I think it's impossible for people who don't have the experience to actually feel what you must be feeling. But from the little that I know and work I've done in the past on long-term care, I can imagine only the incredible stress that everybody was under. But maybe, Roya, you could weigh in a little bit.
Everything started so fast, and we started our cohort in April 2nd. So, and our first case was detected in March. And when they started to swab and do the COVID test for other residents, and it was a very difficult experience because I know most of my residents, but we are like family, you know, so it was difficult to see them in this situation.
How did you manage to, honestly, to survive it?
The only thing at the beginning I was thinking about, I said, yeah, I signed for it and I go. And these people, they need us, all of us. And so that kept me to go.
Roya, you were there on the unit, but Natalie, you weren't working in long-term care.
Yeah, well, I'd been working in long-term care before, both as an orderly and a nurse. And in March, I think it was March 13th or 14th, that the Prime Minister here said, we're going on pause. And the next day they called for help. They said, we need help in long-term care homes. There's not enough people. Half the staff is already sick. I knew I could do it, so I figured, you know, I can help, so I should.
What made you get up every day and go in?
At the beginning, it's definitely adrenaline. You know, it's the fight or flight reflex that just kicks in, and you're just, you know, running on fumes, basically. There's just so much happening. There's no time for you to think about anything else. You know, you're just running around. Because they didn't give us any more staff, right? So we had less staff than usual, and we were, you know, everything takes much longer to do when you're all dressed up. It's not giving meds out to 10 patients takes much longer during a pandemic than during regular time. So you're constantly, there's not a second of your time that you're not on your feet doing something. So I think it's still something I'm trying to deal with and process. Like right now, I could not go back. Just thinking about it, I you know, my breath sort of catches, and it's just, I don't, thinking about it, even walking in front of a long-term care home right now is very, very difficult. And I just see in my mind these images all the time. So in terms of coping, I don't know if I've actually really coped with it.
Right. Yeah.
So, you know, there's stuff that you go through, it takes time to get through, and you've seen so many people die. You know, in one day we lost 10 residents, you know, and I'd never seen, it was it's just, it's hard to it's hard to fathom that something like that could happen on that scale, you know, that it could happen so much. I'd seen death before, but never ever like this. I didn't think that the volume and the quality of the deaths was devastating. We didn't come out of it unscathed.
What's it like now for you and your colleagues, Roya?
We're trying to go back to normal. I don't know how it's going to be our new normal. And now our residents, most of them, I can say, fully vaccinated. And we're starting to reopen, visiting, coming. So that's even, see, these things encourage me to go again, you know. As Natalie said, even going back, thinking about what happened before, it's like, for me, is not easy anymore. Is whatever what we saw and experienced, it was so difficult. We lost a lot of our precious residents, but this is the life. So we try to keep going. Most of my colleagues, they got sick at the beginning when we started. Like at the beginning, I was alone because we didn't have much resident, 5, 6. So I had 2 orderlies and me. We could manage it, and then started very fast to have more and more resident getting sick. And every time our colleague ain't coming to help me, next day I come in and don't see them, and they say, yeah, they got sick too. So, you know, it was so difficult and understaffed, but because they got sick, most of them. Most of my colleagues, they got sick. So,
Roya, I'm interested in, as an internationally educated nurse, you came from Iran. Is long-term care where you want it to work?
I loved it. At the beginning when I came, and because in my country we didn't have geriatric, and so for me it was something new and interesting. Yeah, so I loved it from the beginning.
But it took you a long time from the time you came to Canada to get registered. Is that right?
When I came after equivalency of my bachelor, they accepted and everything was good, but I didn't know about the order. They need us the documents and everything from my country. So if I was in Iran, I was doing and prepare my document before coming could um, accelerate this process. But because I was here already, so it took me several years. That was my fault, actually. But anyway, having young children also and learning new languages took me also the time. But after that, it was because when I came to Canada, into Quebec, I love French language very much. So I started here to learn French first, and so I tried to go to French after I got the green light from order to go to college, get the integration program. Unfortunately, every time I was trying to go to this program, my French wasn't good enough. So that also was that took me again several years. I didn't give up. So I had to change the course and go to English side. So I went. Even my French was much better than my English. They accepted me there, and yeah, I started my integration program there.
So a couple of things. First of all, for the viewers and listeners who are watching, the order is the regulatory body in Quebec. So just like in every province, that's the body that says yea or nay about getting registered. But I have to say, I applaud your determination. You must be very committed to nursing, because we know that internationally educated nurses have often a difficult time. Quebec is not different from many other provinces. I think across the country, people are trying to fix it, but I know it's very difficult. So I'm just impressed that for years you just forged ahead, and I'm glad you're doing what you're doing. But I saw you shaking your head, Natalie, and I wonder if from your association experience, your advocacy experience, whether you hear a lot about, I'll say, the plight or the difficulties or the opportunities for internationally educated nurses.
We need nurses,
Right.
and we should make it easier for them to get their licenses and to get to work. And I'm so glad, Roya, you're here. Like, we need you, and I'm very happy that you're here. And I'm just sad that you weren't able, even though your French was better than your English, you weren't able to go into the French system. That to me is mind-boggling, and it just doesn't make sense. So there's definitely many aspects of that needs to be worked on, and we need the formal nursing leadership, both in universities, colleges, and at our in our regulatory body, to be much more proactive on that. In Quebec, especially, we've talked about a nursing shortage for the past 25 years now. So it'd be nice if we actually do something about it, rather than just lament, well, oh, there's nothing we can do about it, there's a shortage. There is actually tons of things we can do. And especially in long-term care, that's probably where we've been hit the hardest in terms of the shortage. I'm not sure you can call it a shortage anymore after 25 years, but staffing remains an issue.
It's not really
Absolutely.
a shortage in an on and off again kind of thing. It's systemic. But you're saying there are things we should do. I wonder what both of you would, if you had a little magic wand and could make some things happen, what you would tell the people who have some authority to make things happen. What would you want to tell them to do in long-term care?
We could do a whole thing just on that, but I think there's this really amazing group of people called Canadians for Long-Term Care Standards that has started a campaign across Canada to demand that the federal government work with the provinces to establish standards in long-term care. And that to me makes perfect sense. If you go to an emergency room across Canada, you're going to be triaged the exact same way. Whereas long-term care is kind of a free-for-all. One home has certain standards, others there's no ratios, there's no standard for anybody, and that makes it difficult across the board for anybody who's there, for residents, families, staff. Everybody sort of does their own thing, and especially with the for-profit homes, there can be a conflict of interest there when you don't have any standards and you can just make money off of it. For me, that's not something that's healthy and that we should have in our healthcare system. Obviously, for me, probably the most important thing that to come out of the pandemic is to have committees that include residents and their families, sort of a watchdog to prevent some of the stuff that we saw, dying alone and families not, that was the saddest thing I have ever seen in my life, is seeing families in the window when it's cold outside, just trying with their flashlight. It still gives me goosebumps just thinking about it, with their little flashlight on their phones to see inside. That should never, ever, ever happen. And we don't recognize the work that the families do, the caregivers. When they were ripped out of long-term care, we lost all that labor. People who were feeding, who were giving medications, who were helping us do, baths and everything. So that I always knew they did a lot of work, but to have it ripped away, the amount of work that they do is really incredible, and it needs to be recognized. I think it should be paid as well. And obviously, the most obvious part is work on developing strategies for attracting and retaining nurses in long-term care. It seems so basic, but we treat nurses and staff in long-term care as if they are nothing, basically. They're numbers you can just move around without regards to their expertise and their knowledge and their experience. And that obviously makes it difficult to keep people in long-term care when you're constantly adding to their workload without ever giving them anything in return, not even, a basic recognition, like a little pat on the back or anything like that. There's nothing. So of course, you're not going to keep people. It's going to be very, very difficult to attract and keep people. And that's a basic management concept of retention. Why do we not apply it in healthcare? We know that we need it there desperately. And again, it's something that our decision makers at all level of government and in our healthcare system have decided to just avoid for the past decades.
So, but here's Roya, who's there and says she loves it and it's interesting. So, Roya, what would you tell a nurse who's saying, well, I don't know, long-term care, maybe I don't want to go there. I'd rather go to critical care where the excitement is, or, emerge or something like that. What would you say? How would you recruit them?
Our LTC is one of the best, and we are there like a family. And when you're going to work, I don't feel at all I'm going to work. I'm going to my home. I love it, and I encourage people to come and work in elder cares. And as I said, it's not work. It's just joy. I love it.
Jewish elder care is renowned across the province for the quality of the care. It's kind of like the one shining jewel.
I'd then be curious, Roya. So a lot of our work is career work and, individuals who might be interested in an organization. So what makes this organization so unique? Like, why is it like it is?
Actually, we work together. There is no boss, no, our nursing director always coming to us and discuss with us what we should do. Even whatever we want to do in our units, we go to our orderlies, to our assistant nurses and everybody. Okay, what do you think, what we should do to improve it? We work together. That's the reason.
But somebody sets the tone, I guess. So maybe though that's part of the answer to people, is find a place with people like Natalie and Roya who like what they do, love what they do, and work there. I mean, we know when you ask nurses what makes a quality work environment, one of the first things they say is the people I'm working with, my team, other people who want to do the work.
And I think Roya is saying something really important too. You know, when you have a manager, a nurse educator, people that come see you and ask you, what do you think we should do? Instead of saying, this is what we're going to do, and that's it. That definitely sets a tone in terms of how you feel accepted in a team and so I think there's definitely elements of how power or leadership is exercised. I guess you would say that's a francisisme. I'm sorry, but it's important to be heard, and that's also one thing that nurses across the board have always said. If I'm going to stay somewhere, I want to make sure that my voice is heard, and so when you have a manager that says, okay, instead of having 6 patients today, you're going to have 12, and just leaves, that's not a good work environment. You know, a manager that says, well, you're forced to stay a whole other shift today, that's not a good, those are the toxic work environments that have become so prevalent because we don't have a lot of places like Jewish elder care, who really is, you know, the rose blooming in the pavement of LTC. And there are places that are better. Like, it's not across the board that it's terrible. There are some teams, amazing people like Roya. Our system in Quebec is very heavy. There's been a lot of reforms to centralize everything, and now we don't have managers, for example, in long-term care homes. We have like a head nurse, but there's no manager that's responsible for the long-term care home per se. It's, you know, managed by somebody who's sometimes kilometers and kilometers and kilometers away. So that obviously makes it a lot more difficult for the higher ups to know what's going on. And so the lack of channels of communication from the ground up, because we always hear what they want to tell us, but finding a way to talk to people who actually have the power to make stuff happen is very, very complicated. And so that's what made it very difficult. When, you know, one of the first things I asked when I got there was, how do I get more vital signs machine? We had one vital sign machine for hot zones and cold zones, and obviously that didn't make any sense. So I had to figure out who to call, and I called so many people. I emailed so many people just to figure out who knows how to get this. You know, and it's ridiculous that as a nurse, I would have to spend so many hours just trying to figure out how to get a basic working tool that I needed, you know. And it was the same for trash cans, tables, you know, PPE. I don't want to even start. Where I worked until the first week of April, nurses weren't even allowed to wear a mask. It was prohibited, even if people brought their own PPE from home. People were threatened, like, no, you're going to get, you know, suspended if you continue to wear a mask and stuff like that. Whereas, you know, other places like the Chinese hospital here in Montreal, they had been wearing masks since January, and so they avoided a lot of that, the bomb I was talking about that went into these long-term care homes. So that was really a management that was completely disconnected from what was actually happening on the ground, and that, you know, had tragic consequences.
The way you've both described the workplaces you were in, and what I'm hearing from you, Roya, is that there's a different style of leadership that everybody pulls together and has a conversation. And possibly where you were, Natalie, what I'm hearing is maybe more of a top down, and is the success in how people manage through the pandemic back to leadership.
Roya is a big part of why it's going so well at Jewish elder care. You know, so it's important, first of all, to study those places that are doing so well, to figure out what are they doing differently than other places. Second of all, there is data already out there in terms of how it's important for teams to be allowed to be flexible. So we need, you know, to have the possibility to be able to do exceptions without being afraid that we're going to be sanctioned, for example. You know, I did that too, but I was not allowed to do that, you know, but I felt, I'm a nurse. I've been a nurse for 10 years. In my clinical judgment, it is safe for this one person to come and see this one resident. And I think it's okay to do that. And our capacities as nurses extend beyond just what we do between one nurse and one patient. It also extends to the conditions in which we practice. And so as a nurse, for me, I strongly believe it's okay for a nurse, any nurse, to say, 8 patients might not be safe for me today, and have a discussion with the manager about it. But that's not the way the healthcare system is organized right now in Quebec. So there are some shining examples like where Roya is, but we need to study them more. And for that, we need obviously access to data, which in Quebec is very, very, very difficult. And collectively, as a profession, I think we also need to reflect on how we see management and what it means for a nurse to be a manager. Is she a manager or is she a nurse? Is she a bit of both? And what becomes the most important thing? So we need to reflect on the importance that we give as a profession to nurses' bedside practice, and recognize the leadership that exists there, and recognize that nurses who work with patients are also allowed to question and to evaluate their conditions of practice and whether they are safe or not. That's not just a manager's job. I think that's something that we are able and should do on a much more regular basis.
You made a quick comment about a manager is a nurse, and is she a nurse, or he a nurse, or they nurse, or a manager? And Roya, you're an assistant head nurse. How do you think about yourself, as a manager or as a nurse? What's first for you?
Actually, I'm like connection between the management and staff. I know staff very well. I work with them, with orderlies, with assistant nurses, with nurses, and now I'm in management side. So somehow I bring the issues from our job to management. And when management asking me to do something, I'm coming and discussing with my staff to see how we can do that. So I'm in between.
Thank you so much for, first of all, for your honesty, your candor, but really for your passion.
Wow, Gail.
Yeah.
That went on longer than we generally do, because they were both in their own way forces to be reckoned with. Natalie, so passionate about how the system needs to change, and Roya, who was very calm, but had so much just in her story of, she loves what she's doing. This is, again, she loves what she's doing, and she loves who she's working with, and their style of management and the way decisions are made help them through the pandemic.
Well, I just kept, maybe I have a sort of stereotypical view of passion, but I would say both of them were passionate. I think, and she said, of course, Natalie is passionate for change, and Roya is passionate about her work and her connection. And she, by her own story, had a tough time to become registered. Most people will just give it up. It's not like this is the best paid job in the world. So that, I'm sure it's that passion, it's that kind of, I'm meant to do this, so I'm just going to push ahead. And if they don't want me in French, then they'll have me in English. I'm just blown away by that kind of passion from both of them. But also, I don't think we can hear enough how horrible this was. If this, we have to make a change in how long-term care is done in Canada. And, like Natalie said, there are examples of who's doing it well. And we've seen that in other interviews with long-term care, but we need a lot of work to get from what that pandemic brought to what needs really to happen for some kind of quality, both work environment and home environment for residents. Yeah.
This common theme across Canada, or even just, is around how in long-term care are we going to recruit and retain nurses. You listen to the two of them, and I'm saying, well, who's listening to the people on the front line? They do know the answers. They know what needs to happen.
These two women, they could be poster child for not just for long-term care, but for what is the essence of the profession? What do people do? They care and they advocate and they yell when they have to. And when they don't have to, they connect. Every interview episode we've done so far, people talk about their team.
So till next time, here's to Nurses' Voices.
Absolutely. So I would encourage you, if you'd like to give us some feedback on this episode of Nurses' Voices, to go to nursesvoices.ca. Also, please go to and join a podcast through wherever you usually get your podcasts, and look for us on YouTube as well. Thanks very much, and see you at the next Nurses' Voices.
Nurses' Voices is created by Donna Wheeler. It is supported by the Canadian Nurses Foundation and the Canadian Nurses Association. Nurses' Voices is produced by Sector Limited.